Um, Hello, everyone, and welcome. I think hopefully that you can all see and hear me. This is the session that's focused on the data and other type of issues in terms of farm worker health. So we will be recording these. And as with the other session, is that what you can do is you can write in your any questions that you have into the question answer, and then at the end of the time that we'll go ahead and we'll leave some room to ask the questions. You can also do it in chat too, but question and answer is actually a little bit easier for us to kind of to monitor. So to start off with then, why don't we have Ester Cadavid can go ahead and start off. And so you can go and share your screen and proceed. And then you can split between you and Alejandra as you see fit.
Okay, share my screen. So good morning to everyone, and thank you so much to University of Merced for allowing us to present our study. I am Ester Cadavid. I am actually the development director for the UW Foundation. The UW Foundation is a sister organization to the UW that was founded by Cesar Chavez. So what we did this past year has really brought data and technology together to an intersection where we have seen how we need to really push forward one of our core values, which is innovation. And to that end, this is how this whole study came to pass. When the pandemic hit a year ago, we as a movement, all the sister organizations, the Cesar Chavez Foundation, the UFW Foundation, and others, we started beginning to strategize of how to respond to the needs of our farm worker community. We were hearing a lot of needs. And so we immediately began doing massive food distribution, cash card distribution, PPE distribution, in not only California, but in Washington State, Michigan, and Georgia. And one of the things that we continued to do was the regular business. We're an immigration legal services provider. We do public benefit enrollment, and we do a lot of community organizing, kind of advocacy and lobbying around farm worker issues. Everyone got sent home except for our essential workers who were the crew that were doing all these distributions on the ground. We soon started to look at our data, just our immigration data, and we saw we're leaving people behind, namely our seniors, because they couldn't do the teleconsulta model. And so we started just asking questions like, well, we need to know, where the food insecurity occurs. Granted, with farm worker populations, they were food insecure before the pandemic, but this just took it to another level. And one of the things that really pushed our study was that the vaccine was coming and that we're not a health organization. And there wasn't a lot of information about a pandemic and, about even about vaccination and flu rates and how many farm workers get the flu vaccine. And so as we began to plan to go into the vaccination distribution as part of our response to the pandemic, we put out a couple of surveys, and we did it in a very untraditional research way. We didn't have a hypothesis, but we did want to get information. And one of the things that we were seeing, like just in Delano, California, we were doing every Wednesday, late afternoon farm food distribution, 4,000 meals every Wednesday for months. That was the scope. I mean, I think we reached hundreds of thousands of farm workers in our efforts, and we were trying to capture data, and it was hot, and there were wildfires. So there were 3 disasters going on at the same time. So we started pushing all of our recipients. So if you want more information, if you want to know when the next cash card distribution is happening, if you want to know when the next food distribution is happening, or PPE, if you want to know the resources, when we're going Facebook Live, when we're going to be doing certain things, opt into our texting program. So before the pandemic, we had about 7,000 subscribers. I think today we have over 77,000. And of those, more than 40,000 are farm workers, are self-identified as farm workers. Majority of them are in California, but there's a good number also in Washington State. And as we're expanding nationally, we've been, that was kind of, that was a decision that was made on the fly because it seemed to be the easiest thing to do, but it was the best decision that we ever made because our farm worker community was able to text us and back and was able to respond. So we said, okay, well, this is the model that we're going to use to ask questions. We've been collecting testimonials on the ground. We've been hearing the stories because, we've always been plugged into the community, but we're still missing some information. We don't know anything about vaccines. We're hearing a lot. CNN is reporting, vaccination hesitancy, especially with people of color and communities of color. And we're like, is that true? Well, if we're going to be in the vaccination business, then we better, for farm workers, we better find out whether they, do they want a vaccine? And if they want the vaccine, like, where do you want, how do they want to get it? Like, we didn't have any information. What we did have was, our executive director working on the advisory committee for the state on the vaccinations. What we did have was access to Dr. Domingo with the University of California, San Francisco, and her mortality rate by industry that showed that agricultural workers were dying at a disproportionate rate. What we did have was all of the other entities talking about ag workers that they were at higher risk. And so with that said, we said, okay, we think vaccination probably is a good thing. So let's find out more and let's see how do we prepare for it? Like, what do we need to do? And so very lucky that I was able to bring in and start a research department last year with a wonderful data analyst, Alejandro Herrera, who will be speaking today on the data. He is the master of all things database and survey questions and making sure that they are structured the way they need to be structured. Because before, we didn't have any data people or research people. So our communications department was just asking questions that, yes or no, and that gave us pretty much nothing. So we grew our communications department. They built their chops. And so now we have the infrastructure. And I brought in another data analyst who was a master of mapping and GIS. And so between the data surveying and the mapping, it really gave us some good tools about where to go, where to prioritize, what counties to hit up first, and to track a bunch of different variables from data sets that are available of the ArcGIS, satellites, and to really have more information at our fingertips to begin and implement a vaccination strategy. So with that, I'm going to hand it over to Alejandro so that he can talk about how we use the technology in the texting program and how this all got started.
Hi, everybody. As Esther mentioned, I'm one of the research and data analysts with the United Farmworkers Foundation. I'm going to be speaking on the motivation behind our research, as well as our methods, and lastly, some of our findings. In the last year, the United Farmworkers Foundation conducted exploratory research in order to effectively communicate with farm workers through its subscription-based texting program. This research allowed us to provide increased representation for an under-researched community. As outreach has undoubtedly increased during the pandemic, a need for an analytical approach was evident in order to appropriately collect, analyze, and summarize farm worker data. The farm worker community currently subscribed is categorized as a non-probability sample, and through exploratory research, we have been able to gather data in real time to provide information directly related to the topics at hand. To give an overview of our subscription-based texting program, we currently have over 77,000 total subscribers, and over 40,000 of those subscribed have self-identified as being farm workers. Each person has voluntarily opted into this program and received text messages with information that are related to resource distribution, available assistance offered by the foundation and its partners. And these subscribers represent over 582 cities, the majority located across California, Washington, and Oregon. In addition to sending informative text messages, the program also holds the ability to employ surveys in order to ask structured questions. This has generated extensive data that has led to new initiatives. Our abstract reflected 2 surveys that were sent and touched upon age demographics, access to medical insurance, COVID-19 testing, and vaccine sentiment. As the visuals on this slide depict, respondents from both surveys were concentrated in the following states and cities. Esther, can you click? One more. Okay. As we move forward with the methods, next, the UFW Foundation currently utilizes the texting program on a continuous basis. In the last year, the foundation has grown its subscriber base by 50% and has seen a consistent rate of interaction from those subscribed. With this increase, further effort was concentrated in appropriately collecting data through survey form in order to better understand sentiment and need behind different resources. To be specific, as vaccine outreach has increased, further knowledge and understanding was necessary in order to better serve farm workers and advocate for vaccine access. Some of the questions that led to both surveys were: how many farm workers have medical insurance? Do farm workers have access to medical attention? How many farm workers have been tested for COVID-19? Of those who have been tested for COVID-19, how many have tested positive? And lastly, are farm workers willing to get the vaccine? Each survey was distributed by the foundation both in English and in Spanish to ensure accessibility. Both surveys were sent at 6 p.m. due to previous data showing an increased response rate during the evening. Once the surveys were sent, subscribers were given 48 hours to respond. With the first survey revolving around age, medical insurance, and doctor's visits, it was sent in December and yielded over 14,000 total respondents. The second survey revolving around COVID-19 testing and vaccine sentiment was sent in February and yielded over 11,000 total respondents. All data collected and included in our abstract was reviewed and cleaned to ensure the removal of any invalid responses, as well as any responses from individuals who did not match the target audience, in this case, farm workers. In our abstract, we chose to reflect the data of self-identified farm workers who completed both surveys, as it provides a much more extensive view. And in total, 6,242 self-identified farm workers completed both surveys. As I move on to the findings, one more. There we go. As stated, the first survey included questions regarding age, medical insurance, and most recent doctor's visits. The reason we chose to highlight these three variables was to provide an overview of the demographics represented within farm workers who responded to the survey. As you can see on the provided bar graph, the majority of respondents were between the ages of 35 and 54, the second highest age group being 25 and 34. In regards to medical insurance, data reflected that self-identified farm workers who responded to the survey were more likely not to have medical insurance. Exactly 77% of farm workers reported not having medical insurance. When broken down by state, Washington respondents had a higher percentage of uninsured than respondents in other states. While the foundation knew medical insurance access within the farm worker community was low, the extremely high percentage reported was surprising, specifically when compared to the national average of those uninsured. According to a report released by the United States Census Bureau labeled Health Insurance Coverage in the US 2019, 8% of people did not have health insurance at any point during the year. While we realize that the research and findings within the census report were conducted using different methods and population samples than the data we present here today, we feel it is still important to share how much of the farm worker community is unfortunately uninsured. The United Farm Workers Foundation thought it would be important to also ask farm workers when their last doctor's visit was. This provided insight in how frequent farm workers were seeking or accessing medical attention. According to survey data, 45% of farm workers had been to a doctor's office in the last year, while 26% reported having been to a doctor's office in the last 1 to 2 years. Moving on to the second survey that we sent out, it included questions regarding COVID-19 testing and vaccine sentiment. The reason these variables were included in our survey were due to the need for further knowledge to better advocate and provide farm workers with access to vaccines. Our survey questions aimed at identifying whether or not farm workers were accessing COVID-19 testing, and if so, how many of them had tested positive. According to the data collected, 47% of farm workers reported having been tested for COVID-19 at least once. Furthermore, of those who had been tested, 46% reported having received a positive result from a COVID-19 test. In relation to vaccine sentiment, subscribers were asked how much they agreed with getting the vaccine. Data showed that 75% of farm workers said they would be willing to get the vaccine if it was made available to them. As vaccines are becoming more accessible to the public, this information has allowed the foundation to focus advocacy efforts in order to accurately report farm worker sentiment and willingness with getting the vaccine. Survey data has also created an opportunity to advocate for vaccine distribution events to be tailored based on general farm worker data. Thank you.
All right, thank you very much. Again, if you have any questions, go ahead and type them into the question and answer, and then when we're done, we'll go through and ask the panelists the questions. But thank you very much. Our next speaker is Dianna Torres, also from the United Farm Workers. She's the Executive Director and National Vice President of United Farm Workers of America. And she'll be speaking now. So Dianna, should be over to you.
Thank you.
You should be able to share your screen. And I don't know if you could hear my glass thing. Okay, I'll do that at 10 minutes.
Perfect. I actually can hear that perfectly well.
Good, good.
So let me go ahead and pull this up to share. So, hi everyone, I'm Dianna Torres Angulo, and I took part in the cost study for Washington State. And so I think a lot of individuals today, a lot of the great talks, I want to say, Esther, kudos. If I could do the little hand applause, I could with reactions in this webinar, because you guys did something that I think talks a lot about the how we should do things. We talk a lot about what should be done, and you're actively engaging in the how to do what we should be doing. So I applaud you and your team and the efforts that you're doing with the text messaging. Very happy to hear that. So I'm going to kind of give a brief overview of some of the results that we got from the Washington State Farm Worker Study, and really speak on the how. I think we all are very well aware of what we need to do. The pandemic, I think, has allowed us to shine a light on the areas, those are flaws, if you will. And so we all have a good grasp of what the what's are. Now let's talk about the hows. How do we accomplish some of these things? So really the Washington State Farm Worker Study was done directly by the community-based organization Cielo, which is who I represent, Community Cafe, Our Valley, Our Future, Bienestar, and Community to Community. And so that tie directly with the community is and what allowed for the free exchange of information in the study. So this, I think, is one of the biggest reasons that I would say a huge kudos to Ester and team. It was discovering how the community, the Latino community, the Indigenous community, was receiving their information, as well as how they wanted to go and seek out that information. And first and foremost on the list was, very second actually, the first was the news and Visión Telemundo, right? So television is something that they wanted to be able to go to get their information from. Second was friends and family. And then after that, it was coworkers. And then after that, it was social media. And then very last was the radio station. So for Washington State Farm Workers, and this was a range of individuals that spoke Mam, Cancobal, Triqui, Mixteco, in Spanish. And so this is the summary of how they said, both we want to get information, and this is where we go to get our information. And it's something that we at Cielo, and a lot of the community-based organizations, it's something we've leaned into. We call it the chismosa culture, or at least I call it the chismosa culture, which is, it's just laughing, because if it's good and it's a great thing, you're going to hear about it. If it's not a good or great thing, you're also going to hear about it. And you're going to hear about it from that second source, which is friends and family, before you'll ever hear it on any other platform. I relate it back to music, right? We always talk about a lot of the conversations that we end up having is around the register at which communication is both spoken and given, right? There's a difference between the two. And similar to music, if the register is essentially the height or the range of a note, the pitch, the melody, the instrument that's used, the group of instrument. And similar to an instrument, and if the register gets played at too high of a register, it's considered, overblowing. If you're in a wind or a brass instrument, you're overblowing, saying too much. And it's very similar to when you're speaking to the Latino community, right? If you're speaking at too high of a register, you're blowing the message. It's not being delivered. It's not resonating. It's not being heard. It's not something that's conducive or a tune I want to hear. And we have to remember that when we're trying to go about doing, the how of this work, this collaborative, working in solidarity, doing the collaborative methodology or research, or however we want to phrase it or put it. We have to remember it's an orchestra, and we have to tailor it to who it is that's receiving the message, and in the best way that's for them. Something that is critical is understanding that a lot of our community, specifically our community whose first language is an indigenous language, is that a large part of them, right, 70% in the survey that we completed, that Spanish was their second language. And the majority of the how we go about our outreach efforts from an organization or a state agency, it's from the perspective of English as a second language. And so we tailor communication in that way. We go about, blast it on social media. They're going to get it because English is a second language. And that's just not the case. Spanish is their second language. And so when you stop to really pause and think about that, you realize that what you've been trying to say or communicate, maybe you're not seeing that collaborative piece because you're communicating to the wrong audience. And if you're really trying to communicate to that audience that you're wanting to make an impact with, then you've got to take a look at the instruments you're using, and are you overblowing it? Are you playing in a tune that's just not being heard, or just irritating to the ears? Another piece that we think it's important to keep in mind is that there's barriers to education, or there's barriers to, the chat came up and distracted me. There's barriers to healthcare, and some of those barriers were lack of insurance. And a lot of the presenters already have spoken to this, which is there's a cultural aspect that we have to keep in mind. And that is, I would rather work and provide for my family than to take time off. Like, what is that? And personally, it's really hard to articulate culturally how much that's ingrained in you. I was born in the US thanks to the sacrifice that my parents and my grandparents made, but that work ethic has never, I'm not far removed enough to understand that, or to get rid of that sense of guilt of taking a sick day, even if I'm sick, right? And it's one that's hard to articulate to others to, why didn't you just take the time off? And I have, thankfully, a position or a job in which I do have sick pay. But often enough at the end of the year, I have a lot of my sick days left. And why don't you just take a sick day? Because I'm okay. Like, I'm not dying, right? It didn't knock me down. So I'm gonna keep working. I can talk. And so that's the mentality. And it's a cultural piece that we must understand. So lack of insurance, loss of wages, loss of work. And so as we move into the vaccine and promoting the vaccine, and the benefits of the vaccine, it's important to understand also that the decisions made on the vaccine will vary depend on how they're impacted. So informing them that there is no cost to you for the vaccine. If you get a bill from a medical provider, it's because they sought to see you for something in addition to the vaccine, and they're actually billing you for the additional piece, not the vaccine itself. The loss of work, loss of wages, the decisions that they're making about which vaccine that they get. Surprisingly enough, there was a lot of controversy over the Johnson & Johnson, but a lot of the farm workers are like, can you just give me the one that's just one? Because if I'm going to be down, I'd rather just be down the one time, like couple of days, I'm down. And can we do it on a Friday? On a Friday, the effects will hit Friday night. I should be like sick Saturday, Sunday. That means I only miss Saturday work and I can use Sunday and I'm back at it on Monday. or even better, hopefully I don't get anything and I can work Saturday and then, so the decisions that they're making are very much based on a different pyramid, if you will, than I think what the dominant culture thinks, or even, English as a second language population might think. And so those are important things to note. Again, why is that so important? Because the majority of their income affects their ability to access food and shelter. So food and shelter being those primary things when you think of the, the hierarchy triangle, right? Food and shelter. And these all things, they intertwine, and it comes back down to just being mindful of these things as we go when we communicate and how we interact. These are just some direct comments from some of the surveys that we've done. And something as simple as, I didn't go because we didn't have insurance. Well, you don't need insurance. You're okay. The other one was, there's a lot of information and it gets shared and I get it and it's in Spanish and it's in a flyer. I still don't know what it means. I want somebody who speaks my language, my tongue is what they say, mi lengua, mi idioma, to be able to explain to me, what does this actually mean? It says all these words. I comprehend each and every one of those words independently of each other, but then you put them together and I don't know what these people are trying to say to me. And so they're asking, and they often do come to a community-based organization to say, what does this really mean? What are they trying to say here? Also, they are asking for more information on the second shot. When do they get it? How do they get it? I can speak to this elderly woman who spoke mom, and she was talking about how she's like, I'm good. We're vaccinated. Like, I'm super happy. I can do things. And then I was like, okay, when did you get your second shot? Because I'm trying to tell her you're fully vaccinated 2 weeks after that second shot. And her response was like, what second shot? Isn't it just one? I got the one. Like, I'm good. And then doing some of that legwork, and then turns out, she actually got the vaccination that required the second shot. She didn't get it in that time frame, and she has to do it all over again. So then at this point, she's frustrated. She's lost faith in this process and that it actually works. And now she's worried because she was out and about as if she'd been vaccinated and she wasn't. And so it's important for us to communicate these things. And it's important. The biggest piece is communicating for the purpose of really wanting them to be informed, for wanting this community to be empowered with information. You're not coming in to save anybody. You're coming in to make sure that they're empowered to do for themselves. And those little tweaks in how we communicate, how we become that bridge, is critically important. And then also they want to hear who has and who has not gotten the vaccine. It changes when you're having a conversation and the first thing they ask, ¿Ya te vacunaste tú? Well, did you get the vaccine? Because I'm not going to jump. Did you jump? Because I'm not going to jump, and then they want to hear about it. And so that's important. And it's not just, they want to hear from individuals who look like them, sound like them. So in summary, that's really, I'll open it up for more time for others to present and give or ask questions. But in summary, that's really what our COF study was about. It's about highlighting, I think a lot of what we already knew was there, but putting names and statistics behind what was already happening, shining a light to it in a way that we haven't ever before, and then offering a solution for how we can go about addressing all these what's happening. And so again, huge kudos to Esther and team and Alejandro for developing the ability to communicate via text. It's brilliant, and I wish more would do a lot more of that. Thank you again for the time to give us the opportunity to present and share some of these findings.
Well, great. Thank you very much. And again, if you have any questions, go ahead and put them in question and answer. And then at the end of the session, we'll go ahead and we will ask all the presenters the questions at that point. Our next presenter is Wenson Fung. he's going to be talking about the NAS data set.
All right, thank you, Paul. So let me go ahead and share my screen. Okay, so today I'll be talking about the health access and utilization for farm workers and their families in California. And mainly I'll be talking about the new findings from a new health supplement in the National Agricultural Worker Survey, or NAS for short. So for those who are not familiar, the NAS is the National Survey of Crop Workers that we started in federal fiscal year 1989. It's an annual random sample survey of about 1,500 to 3,000 workers. And in California, between 2018 and 2020 fiscal year, we had about 1,500 workers in California. And today I'll be presenting the numbers, the findings from California. And this is an establishment survey. And what that means is that we find workers at the work. So it can be during their lunchtime or after their work or before they begin working. So we find that this is a more reliable way of finding farm workers instead of looking through all kind of the different kind of housings that they have and going to find them in their home. So this is a reliable source of information on crop worker demographics. One limitation that we have is that we have limited regional coverage and no local numbers. So as you can imagine, even with a national sample size of 3,000, we only have a few dozen farm workers that we interview per state. So we will not be able to get numbers by state or by counties. And also currently the H-2A workers are excluded, but we do plan to include H-2A workers in the future. So a little bit about our sampling universe. We currently include farm workers who are employed in the last 12 months. It is in the US only, and crop workers with NAICS codes 111 and 1151. And family members of the farm workers. So we do not interview the family members directly, but we do ask the farm workers about their spouse and their children. Our sampling does not include formerly employed workers. We don't have H-2A workers currently, and we do not have livestock workers, age or disabled workers who are no longer in the crop labor force. And we do not interview the family members directly. So a few notes about reporting policies. In the numbers that I'll be presenting, you might see a superscript A. So that should be interpreted with caution because they have relative standard errors between 31 and 50%. So that means a larger variance than we're comfortable with, so it should be interpreted with caution. And for some of the numbers, you'll see a blank with a superscript B, and those are suppressed because we have fewer than 4 observations or a relative standard error greater than 50%. So let's jump right into the numbers. For this new health supplement, the purpose was to improve the understanding of barriers that farm workers and their families face when accessing healthcare. And we asked about their healthcare visits for injury, illness, preventive care, and dental care. And we interviewed the farm workers, but we also asked them about their spouse and their children who are under 22 years old. We're hoping that the data and the findings will help develop a more robust database response for addressing concerns about agricultural workers and their families' access to healthcare. And we're also hoping that the survey will be able to be used with other data from other national surveys. So the first results that we have is about health visits for routine or preventive care. And let me just back a little bit. We're really excited to share these new findings. I believe this is only the second time that the public is able to see these findings. So pretty exciting stuff. So as you can see here in the first line, 56% of farm workers reported that they had a visit to a healthcare center for routine or preventive care, about the same amount for spouse and a little bit higher for their children. And in the second line here, these are people who reported that they have insurance and visited a healthcare center for routine or preventive care. And we also asked them about their top 3 providers, and it's showing that about half of them went to a private clinic or a doctor's office, and about 45% went to a community or migrant health center. A very low percentage went to a hospital, which makes sense for routine or preventive care. And the top 3 reasons for not visiting was that they don't need to go. Some of them indicated that they did not have insurance, and about 10% indicated that it was too expensive. And these last items for the top 3 reasons, they were able to have multiple, they were able to indicate multiple reasons. And for the farm workers, the top payers was Medicare or Medicaid, followed by employer provided health plan. Some of them, about 20%, paid out of their own pocket. And about 12%, they went to a clinic that did not charge them. We also asked the farm workers about their satisfaction with the care that they received. Almost all of them was very satisfied. So for this population, you'll see that a lot of them, most of them indicate that they're very satisfied. So a more useful comparison would be comparing the satisfaction for different type of care. So for the second category, we asked them about healthcare visits for illness, not as high as preventive care, which is expected. And the top providers were, again, private clinic or doctor's office, followed by community migrant health center and a hospital, a little bit higher percentage here compared to the preventive care. And the top 3 reasons for not visiting, again, don't need to go. A small percentage indicated that they do not have insurance or was too expensive. And so I know these are a lot of numbers. So I will show my email at the end of the presentation. And if you want to get a copy of the presentation, I'll be happy to send that to you. So for the farm workers for illness visits, their top payers were Medicare, Medicaid, out of their own pocket, or employer provided. And again, very high satisfaction rate, but not as high as the preventive care that I showed in the previous slides. So for healthcare visits for injury, very few farm workers, spouse, and their children went to injury visit, which is good. The no numbers here is good. So they went to private clinic or doctor's office, 13% went to a hospital, and about 11% of farm workers went to a community or migrant health center. And the top reasons for not visiting, again, similar reasons: no need to go, no insurance, and too expensive. For the farm workers, the top payers for injury visits were employer provided health plan, workers' compensation, or Medicare, Medicaid. And once again, almost 90%, very high satisfaction rate. And finally, dental care. And this is an exciting section for us because there aren't that many national surveys out there that looks at dental care. So about 30% of farm workers went for a dental care visit, 35% for spouse, and double that amount for the children. Although the percentages are pretty high for children, there is a concern because this is saying 34% of children did not go, and we're supposed to go do dental visits every 6 months, right? So There are top 3 providers, dentists, as expected. And some of them did go to a private clinic or doctor's office or a community migrant health center. And we believe that this is showing that some of these private clinics or health centers have integrated dental health care or dentists. And the top reasons for not visiting, again, don't need to go, too expensive and no insurance. And the top payers, a lot of them paid out of their own pockets. 24% was paid by Medicare and Medicaid, 13% employer provided, and a small percentage was paid for by self or family bought individual health plan. And once again, very high satisfaction rate. And so I'll be talking a little bit about the differential health access within the workers population. So if we break this down by gender, we can see that males, men were less likely to visit preventive care for dental and for any type of visit, mostly. And really busy slide here, but the thing that I want to point out is that those who speak in indigenous language were significantly less likely to visit, to have any visit or for a preventive care visit and for dental visits as well. And for family composition, that we see that parents are much more likely to have any visit for a preventive care visit and for dental visits as well. About the same amount for illness visits. And a breakdown for migrant status. We see here that migrants were less likely to have any visit, preventive care visit, for illness, and for dental care. So a little bit of summary. We see that the annual share of farm workers in California visiting a healthcare provider was 63%. And the most common type of visit was for routine and preventive care, followed by dental care and illness visits. For routine or preventive care, they most often sought care at private clinics and community healthcare centers. For dental care, it was mostly in dental offices and private clinics. Dental visits were less common than medical visits, and dental visits were more common for children than farm workers and their spouse. Children were also more likely to go for preventive care than farm workers and their spouse. And in the demographic breakdowns, we see that the farm workers were less likely to visit a healthcare provider if they were migrant, if they were single, or if they were male. And farm workers who were migrants, male, were less likely to have dental visits. So that's it. Here's my contact info. If you want a copy of the presentation, I'll be happy to send that to you. And on the bottom, you see a website if you want to get more information on the NARS or if you want to obtain the public or restricted data sets. Thank you.
Great, thank you very much. Once again, if you have questions, go ahead and type them into the question and answer. One screw up that I made, Dianna Torres is the community and outreach coordinator with the Washington cough study, so I mislabeled her, I apologize. So why don't we go ahead and we'll start. We have about 10 minutes for questions. So first off, we have a question for, let me find it here. Let me pull up the questions, hang on one second. We had a question, Wenson. Could you go into a little bit more detail about how you get the how you sample and who is it that you're sampling as part of the NOS study?
Okay, so first we would contact the employers. It's a random sample. We first have a list of possible employers to contact, and we randomly sample from that list across the different regions of the US. And so we will contact the employers to see if they will allow our interviewers to go in. And if they do, we would go to the employers and we will sample from their workers at the time.
And that's in 6 different regions of the country, is that right?
It's in 12 different regions. We also break down the results by 6 regions as well.
Right. Mhm. And when you ask about visits, what was the time period? Is that when you're looking at was it the last year or last 3 years or?
It is the past 12 months.
Okay. We have a question from Mr. Herrera. Does the data collection, does the collected statistical data conform with existing knowledge of this information, or was it very different from what was known before the survey? So essentially, it's like how different was your results from what other studies, such as the NOS, might have said?
Yeah, so we didn't have a set hypothesis in terms of what to expect, but the foundation, based off of its research distribution, we do know that a lot of farm workers don't have access to medical insurance, are within certain age groups, and as the data provided, we knew how many of them were somewhat accessing, medical attention. We just wanted to provide this information this information through this survey. So that's kind of one of the intent behind these 2 surveys, to kind of showcase this data rather than just, testimonials from farm workers. We wanted to provide actual information that could be verified through this texting program.
And I also want to add that some of the findings were not surprising. And I think that with the NOS study going through employers, when you go through the growers to get a sample of farm workers who will participate in a study versus you go to farm workers outside of their employer, because there is some tension there. That's why we've had to fight for, wage increases and heat standards and what have you, that you're going to get a different sample of answers. So the sampling we had was of self-identified farm workers, irrespective of the growers. The farmers, the growers that we work with tend to be the unionized growers who do have, do offer medical care, et cetera. But in California, we saw a huge decrease in health access because of the public charge rule. And some of our older farm workers who were on their way to becoming citizen, for citizenship, and the public charge rule saying if you or any family member, takes advantage of Medi-Cal, et cetera, your green card would be in jeopardy. And so I think it's all about where you get the farm workers, and when you go through an employer, that brings in an inherent, I want to say fear factor, or it's like it's different if you sample in the fields, and you can't even get access to the fields unless a grower will allow you in the fields. But if you go to farm work communities and you sample them through the employer, you might have different findings.
I mean, one thing I noticed, and correct me if I'm wrong, Wenson, but it did seem like in the NOS study, if I remember correctly, the numbers who have insurance is much higher than what was being reported, Alejandro, in your data. Did that look right to you? Because I think you were saying it's like 80% of people didn't have, or 70% of people didn't have insurance. And I think in the NOS, it usually reports that about 60 or 70% do have insurance. Do I have those numbers right?
I believe you do, I think, but there's a distinction between, we asked specifically whether or not they had medical insurance, and I believe in the NOS study, they were asking if that was one of the reasons why they didn't go seek medical attention. So I think that's a big distinction. Just to clarify though, we didn't use random sampling in this case. They are subscribed to our texting program, but we do still feel that it's extensive because of the number of farm workers, self-identified farm workers, who are responding to these survey questions. And to answer the second question that was sent on here about how many questions are asked and if that affects the response rate currently, we're pretty fortunate to have a 25% to 28% response rate across self-identified farm workers on our texting program. So as I mentioned previously, for the first survey, we received around 11,000 responses, 14,000 responses, sorry. And then for the second survey, we received over 11,000 responses. The only reason why the number drastically changed on our abstract was because we only chose to report on those who responded to both surveys, which brought it down to 6,242. But the 14,000 and 11,000 were also self-identified farm workers.
So correct me if I'm wrong, but it sounds like the NAS survey surveys mostly people at farms who are working. Your survey is going to be, also include people who aren't working.
Yes. Yeah.
Dianna, the COF study in Washington, did it include, how did your methodology, how did you recruit people?
Our methodology was different as far as depending on the community-based organization, but for the most part, it was a mixture of what Dr. Fung was talking about, going directly out to the workers in their locations. But then Cielo specifically, we had clients, we have clients in the Mom and Cancobal speaking community. And so we just utilize the access that we already have to the clients and the relationships that we already have built, both professionally and then personally, because we're so intertwined with the community. I mean, some of these individuals, they're still family members, cousins, aunts, uncles. And so that's how we went about doing the COF study. And that was the majority of the community-based organizations. That's how we did a lot of the work.
See, any other questions before we give people a 5-minute break? All right, well, let me, on behalf of everyone who was joining in, thank you very much. You all did excellent. It was really interesting. So thank you very much. And I think, Imrinder, correct me if I'm wrong, but I think now we're going to see you on back on another web link.